Do you ever feel fine speaking at home, but the moment you walk into school or a party, your voice just disappears? Like your throat tightens and no words come out, even though you want to talk. That's what kids with selective mutism go through. It's not that they refuse to speak. They physically can't in certain places or around certain people. Imagine loving ice cream but freezing when the server asks, "What flavor do you want?" That's how it feels. It usually starts in young kids, around age 3 to 5, and often gets mistaken for shyness. But it's more than that. It's a real anxiety problem where the child wants to speak, but simply can't in specific situations. Why does this happen? Well, think of it like a phone with bad signal. The voice is there, but the connection drops in stressful places. The main cause is severe anxiety, not trauma or bad parenting. Some kids are born with a more sensitive nervous system, like a car with super sensitive brakes that stop at every little bump. Genetics also play a role. If a close family member has anxiety, the child might be more likely to get selective mutism. Sometimes, a quiet temperament or being extra cautious as a baby can be early signs. It's not caused by being spoiled or stubborn. It's a real mental glitch, like a software bug in the brain's speaking system when stress shows up. So how can you spot it? A child speaks normally at home with family, but becomes completely silent at school or around strangers. It's not selective, it's total silence, not just quiet. For example, a child might nod instead of saying yes, or hide behind a parent when asked a question. They might freeze, look blank, or avoid eye contact. They don't act this way to be rude. They're locked in anxiety. Some kids whisper to one friend, but not others. Others use gestures or lead people to what they want. If this silence lasts over a month, not counting the first month at a new place, and affects school or friendships, it might be selective mutism. There's no blood test or scan for this. Doctors and therapists diagnose it by watching how and where the child speaks. They'll talk to parents, teachers, and maybe record the child in different places. Like asking, do they talk during video calls with grandma but freeze during show and tell? The best treatment, behavioral therapy. One cool method is stimulus fading. Imagine a child loves a toy. A therapist plays with it near the child. Then slowly, a teacher joins. Eventually, the child talks in front of the teacher without fear. Another way is using rewards, a sticker for every word spoken in class. Speech therapy can help too, but medicine, like anxiety-reducing pills, is only used in severe cases and always with therapy. Teamwork between parents, school, and therapists is key, like a superhero squad helping the child find their voice. Right now, there's no guaranteed way to stop selective mutism before it starts, but early help can stop it from growing. Think of anxiety like weeds: pull them early, and your garden stays healthy. If a child is extremely shy, avoids speaking or freezes around others, don't wait. Talk to a teacher or child psychologist. Practice speaking in safe, fun ways like using puppets, whisper games, or talking for their toys. Praise brave speech, even one word. The goal isn't to force talking, but to make the child feel safe enough to try. A warm, supportive environment lowers anxiety and builds confidence, like turning down the brain's alarm system slowly. Good news, scientists are learning more every. Recent studies show that early therapy before age 5 has amazing results. Many kids start speaking in school within a few months. New tech helps too. Some use apps that reward kids for speaking with points, like a game. One cool study used virtual reality. Kids practice talking to a computer-generated classmate in a safe space. Brain scans are also helping us see how anxiety blocks speech, so we can target treatment better. Experts now know it's not just outgrowing shyness. It's a treatable anxiety disorder. The more we understand, the faster kids can find their voices and join the conversation.